Morning, all of you. I am Mahendra Saini, Assistant Professor, Department of Pharmacy, Suresh Gyan Vihar University. Today, I will discuss about the topic is osteoporosis and gout. First of all, today I will discuss the learning objectives of this topic. Based on the content in this chapter, the reader should able to like definition of osteoporosis and gout and sign and symptoms of osteoporosis and gout and pathophysiology of osteoporosis and gout, and next one is causes of osteoporosis and gout. Next one is risk factors of osteoporosis and gout. And last one learning objective is treatment of osteoporosis and gout. These are the learning objectives of this topic. Next one is learning outcomes of this topic. By the end of the lecture, the student should be able to understand like definition of osteoporosis and gout, sign and symptoms of osteoporosis and gout, and third one is pathophysiology of osteoporosis and gout, and fourth one is causes of osteoporosis and gout, and next one is risk factor of osteoporosis and gout, and last one learning outcome is treatment of osteoporosis and gout. These are the learning outcomes of these topics. First of all, definition of osteoporosis. Definition of osteoporosis. Metabolic skeletal disease characterized by low bone density and microarchitectural architectural deterioration of bone tissue, which result in increased bone fragility and susceptibility to fractures. Metabolic skeletal disease. Metabolic skeletal disease are disorder of bone strength, usually caused by abnormality of minerals such as calcium or phosphorus, vitamin D, and bone mass or bone structures, with osteoporosis being the most common. And next one is low bone density. Low bone density. Low bone density, a condition that occurs when the body doesn't make new bone as quickly as it is reabsorbable old bones. And ar- architectural deterioration. Architectural deterioration is natural stone and concrete and mortar are the common material exposed at the facade of architectural structures. And fragility. Fragility is the quality of being easily broken and damaged, and susceptibility to fracture. Susceptibility, the state of being likely to be affected, influenced, or harmed by something. The vertebra, wrist, and hips are the most common site of fracture, in which osteoporosis, vertebra, wrist, and hips are the most common sites of fracture. Vertebra fracture, this is the vertebra fracture, and this is the hip fracture, and this is the wrist fractures. They are most commonly seen in osteoporosis. Next one, this is the section of bone showing osteoporosis, and this is the normal bone, and This is the osteoporotic bond. Osteoporotic. Osteoporotic means cause bond to become weak and brittle. So brittle that is fall or even mild stress such as bending over cuffing can cause a fracture. Next one is pathophysiology. Pathophysiology of pathophysiology of osteoporosis. Result of prolonged imbalance of remodeling. Result of prolonged imbalance of bone remodeling. Bone remodeling is a lifelong process where mature bone tissues is removed from the skeleton and new bone tissues is formed, and bone remodeling occurs through a individual lifetime. Bone remodeling occurs through an individual's lifetime, and normal adults, the activity of osteoclasts means bone reabsorption is balanced by that of osteoblast bone formation. Osteoclast means bone destroying and osteoblast means bone formation. Normal bone remodeling in the adults result in gradually increased bone mass until the early 30s, and with aging the peak bone mass is gradually decreased, and like first one is calcitonin which inhibit bone reabsorption. Calcitonin which inhibit bone reabsorption and promote bone formation. Promote the promote the reabsorption. Calcitonin which inhibit bone reabsorption and promote bone formation. Next, estrogen which inhibit the bone breakdown. Estrogen which inhibit bone breakdown, it means breakdown, decrease the formation of bone. And PTH, estrogen. Estrogen is a category of sex hormone responsible for the development and regulation of the female reproductive systems, and there are three forms. Estrogen are present in the three forms like estrol and estradiol and estriol. And next one, PTG, parathyroid hormone, increase bone turnover and reabsorptions means increase. Next one is risk factors of osteoporosis. Risk factors of osteoporosis, female more than males. The osteoporosis mostly found in females more than males, and increase as and inadequate intake of calcium and vitamin D and estrogen deficiency or menopause, and family history of patient and lack of physical activity, smoking, alcohol consumptions, medications like corticosteroids, anti-seizures. These drugs are cause the osteoporosis because side effect of these drugs, and low weight and body mass index. Low weight and body mass index and Caucasian, a member of a role of peoples, a member of a role of peoples who have white or light colored skin. Caucasians means a member of a role of peoples who have white or light colored skin. Next one is causes of osteoporosis. Causes of osteoporosis. First one cause is idiopathic as related osteoporosis, most common. The most common cause of osteoporosis is idiopathic as related osteoporosis. Idiopathic as related osteoporosis. Idiopathic is a of an unknown cause, any disease that is of uncertain or unknown origin may be termed idiopathic. And next one is senile, in which idiopathic age related osteopathy. First one, young adults, and second one is postmenopausal, and this is the type first osteoporosis, and senile is a type 2 osteoporosis. Senile, behaving in a confused and strong way and unable to remember things because of old age. Next one is osteoporosis secondary to disease state. Osteoporosis secondary to disease state. First one is metabolic conditions, and example of metabolic conditions like calcium deficiency, vitamin D deficiency, and malnutrition, scurvy. Malnutrition, scurvy. Malnutrition. Malnutrition occurs when the body doesn't get enough nutrients, cause include a poor diet and digestive condition or another disease. Next one is endocrine conditions. Next one is endocrine conditions. Example, hyperparathyroidism. Hyperparathyroidism is a condition in which one or more your parathyroid glands become overactive and release secret too much parathyroid hormone. This causes the level of calcium in your blood to rise, condition known as hypercalcemia. And next one is renal disease and gastrointestinal liver disease and bone marrow infiltration. Bone marrow infiltration example is leukemia. Leukemia is a cancer of blood forming tissues including bone marrow. Next one is drugs like phenobarbital, thyroid hormones, and corticosteroids. These drugs are cause the osteoporosis. And next one is lifestyle. Lifestyle depending osteoporosis. Example, nutrients and alcohol, smoking, inactivity, immobilizations, and excessive caffeine intake cause the osteoporosis. And last one is miscellaneous. Example, rheumatoid arthritis. Next one is sign and symptoms of osteoporosis. Sign and symptoms of osteoporosis. Osteoporosis has been called silent disease. Osteoporosis is a silent disease, and because bone mass is lost over many years with no sign and symptoms, in which silent disease means osteoporosis, and because bone mass is lost over many years with no sign and symptoms, and like loss of height and back pain, vertebra collapse. Vertebra collapse is a Drauger humps. Vertebra collapse means bone density plus minus 15D and occurs when vertebra collapse occurs when one or more bone in the spine weeks and cramps. And next one is Drauger's humps. Drauger's humps is a outward curvature of the thoracic vertebra of the upper back. And next one, the progressive spinal deformity in osteoporosis. Progressive spinal deformity in osteoporosis below the as 55 year, below the as 55 year, this type of osteoporosis, and below the as 60 year is this type of osteoporosis, and after 75 year or this type of osteoporosis, deformity of spinal deformity in osteoporosis. Next one is diagnosing osteoporosis. Diagnostic of osteoporosis. First one is First one diagnostic study of osteoporosis is X-ray studies, and in which X-ray studies determine bone density, determine bone bone density, and next one is radiographic, in which study the bone mass means osteopenia. Osteopenia, a condition that occurs when the body doesn't make new bone of quickly as it's reabsorb old bones. And next one is ultrasonography. Next one diagnostic test is ultrasonography, in which ultrasonography determine bone density. And next one is dual energy X-ray absorption. DEXA. DEXA is a diagnostic test of osteoporosis. DEXA means dual energy X-ray absorption. Well energy X-ray absorption is the preferred modality for measuring bone mineral density. BMD. BMD means bone mineral density. These are the diagnostic tests of osteoporosis. Absorb, ab, absorptionmetry is a measurement of amount of radiation absorbed as by living tissues, especially to determine density, compare dual energy X-ray. And next one, prevention and medical management of osteoporosis. Prevention and medical management of osteoporosis. The main goal of treatment is to prevent development of osteoporosis and to stabilize remaining bone mass, in which osteoporosis, the main goal of treatment is to prevent development of osteoporosis, and second one is stabilize remaining bone mass. These are the prevention and medical management of osteoporosis. Osteoporosis, a condition in which bone become weak and brittle. Next one, a calcium-rich diet, especially in childhood osteoporosis. A calcium-rich diet, especially in childhood. Adolescents may need 12 mg, and postmenopausal women may need 15 mg daily per day calcium. And milk, cheese, and yogurts are rich in calcium. Milk, cheeses, and yogurts are rich in calcium, and elderly should be advised to take 400 to 800 unit of vitamin D, and daily comes from two sources, the sun and fortified dairy products like egg yolk, salt water fish, and liver. Next one is never smoking in osteoporosis. Next one is exercise. Exercising regularly in childhood and adolescence can ensure that you will reach peak bond density. And next one is alcohol. Alcohol, caffeine intake should be avoided in the osteoporosis. And women with low body weight, those with eating disorders should receive appropriate evaluations and dietary counseling. These are the prevention and medical management of osteoporosis. Next one is drug therapy for the osteoporosis. Drug therapy for the osteoporosis. First one is calcitonin. Calcitonin is a synthetic thyroid hormone usually prescribed as a daily nasal spray to reduce factors that cause loss of calcium and increase reabsorption of calcium in the gastrointestinal tract. And next one is selective estrogen receptor modulators. Selective estrogen receptor modulators are give the therapy during the osteoporosis. An example of selective estrogen receptor modulators like loxafen and doramifene. These are the examples of selective estrogen receptor modulators. And third one, drug therapy is hormone replacement therapy. Third one therapy is hormone replacement therapy, in which hormone replacement therapy to increase serum estrogen level and which in turn decrease the rate of bone reabsorption because serum estrogen level responsible for the bone reabsorption. Next one topic is gout. Next one topic is gout. The definition of gout. Definition of gout. Gout is a metabolic disorder of urine metabolism. Gout is a metabolic disorder of urine metabolism, and metabolic disorder means metabolic disorder is a disorder that negatively alter the body processing and distribution of macronutrients such as protein, fat, and carbohydrate, and characterized by intermittent attacks of acute pain and swelling and inflammations. These are the characters of gout like acute pain, swelling, and inflammations. Urine metabolism. Urine metabolism refer the metabolic pathway to synthesis and breakdown purines that are present in many organisms. Urine is a aromatic heterocyclic compound of carbon and nitrogen, and purine like adenine and guanine participate in DNA and RNA formations. Next one, it always processed by hyperuricemia. It's always preceded by hyperuricemia. Hyperuricemia and excess of uric acid in the blood. Hyperuricemia means excess of uric acid in the blood, and uric acid range like 4.0 to 8.5 mg per dl in adult males and 2.7 to 3.7.3 mg per dl in adult females. And hyperuricemia means 6.8 mg per dl and excessive amount of uric acid production. Excessive amount of uric acid production cause the gout, and decreased acceleration of urine cause the gout, and or both. Next one is primary hyperuricemia and gout, and second one is secondary hyperuricemia and gout, identifiable associated conditions. Uric acid undersaturation. Uric acid undersaturation 80 to 90%. Uric acid undersaturation 80 to 90% in primary hyperuricemia, and urate overproduction 10 to 20% in primary hyperuricemia, and urine intake urine intake urine intake shellfish, red meat, and idiopathic, and PRPP synthesis overactivity. PRPP means phosphori phosphoribosyl pyrophosphate is a pentaphosphate sugar, and idiopathy means developed during course of other disease like lymphomas, chemotherapy, and chronic kidney disease. Cell death. Idiopathy means of unknown cause, any disease that is of uncertain or unknown again may be termed idiopathy. And lymphomas is a cancer of the lymphatic system, and chemotherapy is the use of drugs to destroy cancer cells. And some drug therapies like thiazide, diuretics, furosemide, ethacrinic acid, and aspirins. These drugs are used in the secondary hyperuricemia treatment. And some drug disorders, diabetic ketoacidosis, and lead poison, lymphoproliferative disease, and hemolytic anemia, paralysis. These are the causes of secondary hyperuricemia. Porosis means a condition in which skin cells build up and form scales and itchy dry patches, and dual mechanism obesity and hypoperfusion to joints. Next one is uric acid production and excretion. Uric acid production and excretion. RNA and DNA for RNA and DNA RNA and DNA able to formation of purine, and after then formation of purine, then hypoxanthine and xanthine, then uric acid. Purine to hypoxanthine formation by the phosphoribosable phosphoribosable pyrophosphate enzyme is responsible for the conversion of purine to hypoxanthine, and hypoxanthine to xanthine conversion is responsible xanthine oxidase enzyme, and xanthine to uric acid conversion responsible is the xanthine oxidase in low water soluble. Uric acid is low water soluble, and next the hyperuricemia called deposit of urate crystals. Uric acid freely filtered Uric acid freely filtered through by glomerulus and reabsorbed by tubular secretion, tubular fluid, and reabsorption by tubular fluid is treated by probenecid. Next one, these are the this is the diagram of gout, and first metatarsal joints of big toe and podagra wakes up feelings like toy on fire and fan most severe in hours after attack and can't last day and weeks. These are the elbow, wrist, and ankle and knee joints accumulation of urate crystals and cause the gout. Next one is pathophysiology of gout. Next one is Pathophysiology of gout. Uric acid increase in blood, then react with sodium and sodium crystals. Tophi are the symptoms of gout, a condition where uric acid crystals in joints like those in your feet and hands. After deposition in soft tissues and joints, sodium crystals cause the inflammation, and this inflammation is treated by the indomethacin. Indomethacin is a non-steroidal anti-inflammatory drug, and after inflammation, infiltration of granulocytes that phagocytes the urate crystals, and these urate crystals are treated by the colchicine medicine and generate free radicals, and free radicals damage the tissues. The free radicals are damage the tissues, and these are treated by the colchicine, and after damage the tissues, release of proteolytic enzymes like glycoprotein and release of lactic acid, and release of lactic acid is inhibited by the colchicine, and more precipitate of urate crystals, and these are treated by the colchicine, and colchicine release of lysosomal enzymes. The colchicine drug are release of lysosomal enzymes and destructions of joints. This is the pathophysiology of gout. Next one, symptoms of gout. Free radicals. Free radicals are unstable atoms that can damage cell and causing illness and aging. Next one is symptoms of gout. Acute joint pain, and next one symptoms is swelling in the joints. Swelling in the joints, and skin may be in red color and shiny appearance, and formation of typhi. Formation of typhi. Typhi are symptoms of gout, a condition where uric acid crystals in joints like those in your feet and hands. Next one is causes and risk factors of gout. Hereditary factors 40 to 450 years. The hereditary factor of gout is 40 to 50 years, and consumptions of alcohol, especially beer, and excessive consumptions of red meat, internal organs, and trauma to joints. These are the causes and risk factors of gout. Next one is diagnosis of gout. How to diagnose gout? Like joint fluid aspiration. Joint fluid aspiration is a procedure to remove fluid from the space around an joint using a needle and syringe under local anesthetics. And next one is blood test, serum uric acid level, and X-ray. These are the diagnostic tests of gout. Next one is acute gout. First one type is acute gout, in which acute gout, painful arthritis, attack of sudden onset, painful arthritis attack of sudden onset, and usually occurring at night or in early morning. The acute gout early occurring at night or early morning. Next one, arthritic pain worsen progressively. Arthritic pain worsen progressively and generally involves on one or few joints. And most common site of initial attack like metatarsal pharyngeal joints, metatarsopharyngeal joints, and other sites like ankle joints, heel joints, knee joints, wrist joints, elbow joints, and fingers. These are the other sites of acute gout. Next one is chronic gout. Next one is chronic gout. Frequency of attacks increase. Frequency of attacks increase in chronic gout and continuous deposit leads to damaged joint and chronic pain. Next one, patient may develop large subcutaneous type stones in pinna of external ear, eyelids, nose, and around joints. The urate crystals in kidney leads, renal disease, and articular cartilage may be destroyed, resulting joint deformities. Articular, de- articular cartilage. Articular cartilage is the smooth white tissue that cover the end of bones. Next one is gout treatments. The goals of gout treatments like terminate acute attack, terminate acute attack of gout, and provide rapid, safe pain, anti-inflammatory relief, and prevent complications of gout like by the destructive arthropathy, destructive orthopathy, uh, arthropathy occurs not only in septic arthritis and inflammatory rheumatism, but also in osteoarthritis. Next one is typhi and renal stones. Next one is renal stones. Classification of drugs used in gout. CAPS. CAPS means classification of drugs used in gout. First one, acute gout treated by the colchicine, corticosteroids, and non-steroidal anti-inflammatory drugs. And chronic gout is treated by the inhibit inhibit uric acid synthesis like allopurinol, Fabustat drugs are used for the inhibition of uric acid synthesis and also known as urostatic, urostatic, and increased uric acid excretion inhibited by the probenecid and sulfipyrazole. Uricosuric. Uricosuric drugs are drugs that promote the excretion of uric acid and are used in the patients we have who have got gout. Next one. These are the references of this topic. And first one reference is Clinical Pharmacy 10th edition 2010 by P.N. Bennett. And next one is Clinical Pharmacy and Therapeutics 5 September 2011 by Roger Walker, Cataviclasia. Next one reference is Pharmacotherapy and Pathophysiological Approaches, Wipro 7th edition. And next one reference is Essential of Medical Pharmacology, Gadi Tripathi 5th edition. And Basic and Clinical Pharmacology, Bertram G. Jung 11th edition. And next one reference is Regendale's Pharmacology 6th edition. And seventh one reference is Pharmacology and Pharmacotherapeutics R.S. Sotagar 20th editions. These are the references for osteoporosis and gout. Next one is multiple choice questions of osteoporosis and gout. First one question, at what age do you have the most bone density? Option A is your 20s, option B your 30s, option C your 40s, and option D your 30, 50s. The right answer is B. 30s is the 30s is the right answer. And next one question, which of these activities could cause a broken bone in someone with osteoporosis? Option A is puffing, option B is lifting, option B is bending, and option D is all of the above. The right answer is B, all of the above. Cupping, lifting, and bending. These are the activities cause the broken bone in someone with osteoporosis. Next one question. How many white women as 50 and older have at least one broken bone because of brittle bones? Option A is 75%, option B 50%, and option C 35%, and option D 25%. The right answer is B 50%. Next one question. What do men lose bone at the same rate as women? Option A is as 55, option B as 65, option C is as 75, and option D is as 85. The right answer is B as 65. Next one question. Which test is used to screen for osteoporosis? Option A is blood test, option B special type of X-ray, and option C urine test, and option D all of the above. The right answer is B special type of X-ray. Next one question. What cause a dogger's humps or stopid posture? Option A is spinal bone spurs, and option B is inflexible spine, and option C broken vertebra, and option D none of the above. The right answer is C. Broken vertebra means Drager humps. Broken vertebra called the Drager's humps or stopid posture. Next one question. What cause a Drager's humps and stopid postures? Option A is spine bone spurs. Option B is inflexible spine. Option C is broken vertebra. And option D, none of the above. The right answer is C, broken vertebra. Next one question. Which kind of exercise can help prevent osteoporosis? Option A is swimming. Option B is running. Option C is weightlifting. And option D, B and C. The right answer is D. B and C help the prevent of osteoporosis. Next one question. How can osteoporosis be prevented? Option A, eat a low-fat diet. Option B, exercise every day. Option C, get enough calcium and vitamin D through your lifetime. Option D, B and C. The right answer is D, B and C. Exercise every day and get enough calcium and vitamin D through your lifetime is prevent the osteoporosis. Next one question. How is osteoporosis treated? Option A is medicine, option B is surgery, and option C X-ray treatments, and option D it can't be treated. Option A medicine, by the medicine osteoporosis treated. Next one question. Which of the following is not a first line option for the pharmacological treatment of acute gout? Option A is non-steroidal anti-inflammatory drugs. Option B, corticosteroids. Option C, oral colchicine. And option D, aspirin. The right answer is D. Aspirin is not a first line option for the pharmacological treatment of acute gout. Next one question. How long after the onset of an acute gout attack Should pharmacological therapy be initiated? Option A, within 1 hour. Option B, within 24 hours. Option C, after 24 hours. And option D, after 48 hours. The right answer is B, within 24 hours. Pharmacological therapy be initiated in acute gout attack. Next one question. Which of the following is the recommended first line urate lowering therapy to consider? Option A is febuxostat, option B allopurinol, option C probenecid, and option D benzobromine. The right answer is B allopurinol. Next one question. Which antihypertensive has been shown to have mild uric effect in patients with gout? Option A is lisinopril, option B amlodipine, option C propranolol, option D losartan. The right answer is D. Losartan is a right answer. Thank you. Thank you all of you for a wonderful session.